My name is Dr. Stephen McAnany. I'm an orthopedic spine surgeon at the Hospital for Special Surgery. I have a particular emphasis on minimally invasive as well as robotic and navigated spine surgery. Some of the common conditions that I see and treat include degenerative disorders of the cervical, thoracic, and lumbar spine. These include degenerative disc disease, acute disc herniations, things such as spondylolisthesis, which is a slipped vertebra, as well as lumbar and cervical spinal stenosis. I had a water skiing accident in high school that produced a spine problem that had a lot of nerve-related symptoms, and so I actually had spine surgery myself when I was in high school. And from that point forward, the relief of the pain that I experienced left quite a mark on me, and that was something that, as I entered the medical field, I always remembered and thought about. And so it was that desire to be able to enact that same level of change in my patients that led me to spine surgery. Minimally invasive and robotic navigated surgery is really the cutting edge of spine surgery. I believe that it makes the patient experience safer. I can decrease length of stay. I can decrease complication rates for the patients. I can also provide them with better outcomes. I really like to spend the first portion of the visit letting the patient talk and really seeing what they say in their own words in terms of what symptoms they're having. And from there, I can corroborate the symptoms with what I find on my physical examination and what I see in imaging. It's really an interactive patient visit where I like them to be involved and understand, both from the symptom side as well as the imaging side, what exactly the disease process is and how we can treat it.